Heart failure is a difficult diagnosis to understand. It affects the patient's life, their family, and their communication with their caregiver. Today, we are talking about the heartfailuematters.org, a patient website from the Heart Failure Association of the European Society of Cardiology. Joining me today, the current chair of the Heart Failure Matters, Professor Stefan Zirk, and Maggie Simpson. Let's start with the big picture. Stefan, for someone who has never used it before, what is the heartfailuematter.org?
Heartfailuematters.org is a free educational website for people living with heart failure, their families, their caregivers, nurses, physicians, and other health professionals. So it is a trustworthy, reliable source, freely accessible, and it is made to explain to patients in a way that is medically reliable and at the same time easy to understand how they actually should cope with daily living activities with respect to heart failure. So it helps people to understand what heart failure means, what symptoms are, what medication can be taken, how problems can be solved, and how to apply it in regular life.
And Maggie, why is it so important to the patients?
So the time we spend with patients in the hospital or in the consultation room was a very, very small part of their entire journey with heart failure. And so having a website helps them have a safety net almost, that when they're not in front of a healthcare professional or in a clinic, there's somewhere they can go to for information. We give people lots of information. We tell them what heart failure is. We tell them about medications, devices, self-care, symptoms. It's a lot to take in and retain. So having the website allows people to have somewhere to go at a time that suits them, to just take little bite size of information to help them understand what's been told in the hospital setting.
So, Stefan, it's not just understanding the condition, the disease. How does it help in the daily life of the patient?
So the website serves as a practical tool to explain to patients what actually abstract labels like symptoms, medical conditions, and terms mean, and how they actually can take it and apply to their daily living. In particular, the site contains practical tools, medication charts, charts to monitor the symptoms, and many practical applications that can be used in their way to cope with the disease. And for example, they can check which questions can be uh, recorded prior to a clinic visit. So that makes the interrogation and the consultation with the physician much more efficient because they are better prepared. So instead of worrying with a certain condition, they can prepare ahead.
Okay. And Maggie, we know that heart failure does not just influence the patient himself, but it influences significantly the families and caregiver. How the website can help them as well.
Yeah, so we know that when caregivers are involved in um, the, the settings of where information is given, when they understand heart failure, it helps them support the person living with heart failure. It helps them recognise symptoms earlier too. And we give them skills and information to help them and their partner live with heart failure, or their other family member. The website is catered for them, specifically sections for families and caregivers, recognising the role that they have in heart failure care. It understands that it affects them too. It'll have an impact on their life. And it really helps to support those caregivers. And we know that when caregivers are supported, it results in better outcomes for the person with heart failure, better quality of life, reduced hospitalizations. And so the website really helps empower those caregivers with the information they need for them to live with heart failure, but just from a different perspective.
And I ask you as well, as in from the nursing point of view, how this website should be used.
So this is a fantastic website. to signpost to people, whether we're in a clinic or maybe in a hospital setting discharging someone. Like I said, most people live with heart failure outside a healthcare setting, and so they need information when we're not there. So as a nurse, I use this website. I give it to patients in clinic. In some areas, we have kind of QR codes on the wall, and we use it to explain heart failure or components of living with heart failure with patients, but also as a check to see what they've understood. So the next time we see them, we can ask, when you read that page on the website, was there anything you didn't understand? Can you explain to me what you've read? And it helps us assess whether someone has understood the information given. So it's an incredibly valuable resource, not just the text on screen, but as has been mentioned, the videos, the monitoring toolkit that's there. It provides, like I said, a safety net for patients when we're not sitting in front of them.
And Stefan, as a physician, why should doctors recommend the use of the heartfailureMatters.org?
So I think a very important feature of the website is that it is based on the current guidelines of the European Society. And the website was developed by the Heart Failure Association under the umbrella of the ESC. So it represents a trustworthy source. And from a physician perspective, it's very important that the patient actually has some additional information he can or she can refer to. And we all know that the information that is spread on the internet, some of it is excellent, but some is confusing and some may be outdated or even misleading. So physicians know that a patient who is better prepared, better informed about his or her condition is a better patient. So it's much easier to involve this patient into shared decision making and make him ask the right questions that are sometimes very severe questions to be answered with such a severe condition.
And Maggie, you think this site can improve the conversation between the patients and the professional healthcare?
Absolutely. So for patients, it might trigger questions that they didn't think they could maybe ask us as healthcare professionals. It's a resource that goes far beyond the diagnosis itself. It's about living with it, and also helps them see experiences of other people living with heart failure through the videos, and might help them recognize some aspects of that in their own life. We know that the website is available in 11 languages. We live in a world where people move countries. And so for me in the UK, that's a fantastic resource that I can help people that English isn't their first language. And there's no other website that provides that for me.
And second, the website not only proposes data, but also videos, animation. Why is that so important?
Yeah, the website was developed with nurses and patients. And so we know and we learned that patients and their caregivers, they learn in different ways. So each individual has different preferences how to actually access information and how to learn and work with it. And so the website provides different options for that. So it's simple text, but it's also animated videos, charts, control boxes. And so anyone can choose from which source he or she wants to get the information and work with it. So that's yeah, something which is very particular about the website. And at the same time, it's very important that you can learn with your own speed. You can access the website, you come back to it, you can read it a second time as often you want to do it and revisit this information.
So I'll ask you as well, the website also includes the updated patients guidelines. Why this is so much high value for the patients to have those guidelines?
Yeah. As we all know, the regular guidelines is a large body of text in academic text, which is not comprehensible to patients. So the patient guideline, which is also available in all the languages, provides a comprehensive overview in plain patient language. So these texts and images were actually produced with the help of patients So they are easily understandable, accessible, and are actually the essence of the guidelines that can be used for everyday life.
Okay. So, Maggie, how can we simply include this website in our routine care?
Yeah, so there's lots of ways. So some people have a link to the website in their discharge letters. Some people have printed QR codes to put on the walls of clinic. But very simply, even just in conversation with patients, telling them about the website, showing it on our mobile or our desktop in clinic is very helpful. But also sharing with other healthcare professionals. You know, this is something that is good for us as well as the patients. And if we help remind our colleagues that it exists, embed it in clinical pathways, and use it as our primary education tool, then we can really get the most from the website and support patients with getting as much information as they can about their condition.
So, to finish, for both of you, what is the one message that you want to have for both the patients, the caregiver, the nurses, doctors, and family to remember about this website?
From my point of view, it's a great source for different professions that deal with heart failure. And of course, for patients, families, caregivers, to find a reliable, trustworthy source where they actually can build on with confidence. So, physicians can improve communication with the patient. Um, nurses can.
Yeah.
Nurses can.
So we can share the website with our patients and really highlight, you know, there's lots of information out there, but this is accurate, reliable, guideline based, and really sets a standard of the information that people with heart failure get no matter where they live.
And I think it's very important to note that the website actually enhances the team approach. So we've alluded in our conversation that it's, let's say, the many facets of heart failure, the comorbidities, the many medications, the many possibilities, the trajectory uh, makes it a very complex, but also a very common problem. And the most important source in that context is the patient themselves.
Mhm.
So they can turn to this source and draw confidence from it. And maybe let's finish with it that the Heart Failure Association puts very much effort in it to keep this website updated and spread its outreach. We will increase the content, we will stay updated, and we will also add other languages to bring the best benefit to our patients.
I agree. Thank you, Stefan. Thank you, Maggie. Thank you for joining us. And for more information and practical tools, please visit the heartfailuematters.org website. Thank you.